Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. How can chiropractic help with knee pain? Well, knee pain is a common problem that affects about 25% of adults. The risk for knee pain is higher among older adults and overweight people. And for adults 50 and over, osteoarthritis is the most common cause of knee pain, and knee pain resulting from osteoarthritis is a common reason people get knee replacements. And needless to say, a painful knee can limit mobility and affect your quality of life. Chiropractic care is really one of the best treatment options available to treat knee pain. Like a knee replacement, it doesn't involve surgery, and some people prefer it since it's non-invasive. Plus, you can use it as preventive care to avoid future problems. So the knee is a hinge joint where the thigh bone, the femur, meets the shin bone, which is your tibia. And this joint consists of ligaments, tendons, bones, and muscles that work together to help the knee bend and support the body when running, walking, and standing. Between the femur and the tibia bones is cartilage that provides cushioning. This cartilage acts like a shock absorber and minimizes friction between the bones. It also produces synovial fluid that keeps the cartilage smooth to help reduce friction. Ligaments are tough tissue bands that connect the femur to the tibia, and they prevent the knee from sliding out of position when moving. Muscles, including the quads and hamstrings, provide the force needed to bend or straighten the knee. Common knee injuries are the following. You can have iliotibial band syndrome. It occurs when the iliotibial tendon running from the hip down to the outer thigh to the knee swells, and then swelling results from constant rubbing of the tendon against the knee joint, which can happen when the tendon gets too tight and close to the bones. Rheumatoid arthritis and psoriatic arthritis is another issue. It's when the immune system attacks the healthy joint, the knee, and this can also affect other body parts too, like blood vessels and the eyes. When they attack the knee joint, they cause stiffness, swelling, and pain. You can't have two conditions at the same time. So if you have rheumatoid arthritis, you can't have psoriatic arthritis. Next is osteoarthritis. This is basically when the cartilage wears out, bones rub together, and that causes pain and swelling. Chiropractic care can't restore the damaged cartilage, but we can help prevent the condition from getting worse. Next is cartilage degeneration. Again, when the cartilage wears out and no longer provides enough cushion. This problem occurs progressively over a long time and gets worse with age, but it can also happen with people who exercise a lot. Bursitis is where the bursa, which is a source of fluid that helps reduce friction in the joints, gets swollen and inflamed, adding pressure to the neighboring tissues. And this can occur from constant pressure, like with kneeling. Tendonitis is when a tendon feels tender with a dull pain, and occurs when a tendon swells after an injury and affects people who do repetitive exercises like running and sports. And this next is a dislocated kneecap. Patella, or the kneecap, gets dislocated. Torn meniscus is another issue where the C-shaped cartilage that absorbs pressure between the shin bone and the thigh bone gets torn, and that can be due to trauma or degenerative disorder. You can have torn ligaments as well, fractures, things like runner's knee too, which is just structural damage from walking and running a certain way, and is painful when you stand up or sit for a long period of time. So how do chiropractors treat knee injuries? Well, when you come and see a chiropractor, you get an exam, determine the cause of the knee pain, and after their diagnosis, we'll know if you're a good candidate for chiropractic care. We do knee adjustments, and that causes the joint to become better aligned. A well-aligned joint exerts less pressure in the tissues and causes less pain. Also decreases inflammation and helps recovery from injuries. Also, we can help teach you how to stand with proper posture to distribute your weight evenly on your knee joints to prevent future problems. Also can help with knee bursitis, which is the fluid-filled sac in the knee joint, and chiropractic can treat this by removing pressure from the area and reducing inflammation. Also, same thing with osteoarthritis, decrease inflammation, and proper aligned joint moves much better than one that's not properly aligned. So in conclusion, chiropractic can be very helpful for knee injuries. If you know somebody who's got knee injuries or knee degeneration, knee pain, there's a very, very good chance that we can help them out. Check us out at newhopechiropractic.com. You can also make an appointment through our website, and we look forward to helping you get over your knee injuries and knee problems. Have a healthy day.